We're good now. Let's do it.
Hey. Hey, yeah. Ain't need like that. Let me say. Hey. Cause I've been trying to be practical. Let me take a sabbatical. Apparently what I'm saying too radical. And y'all can't stomach.
Man, all right. So I'm finna get off of Facebook, y'all. Cause I just I went back home and I see something talking about free pickleball for everyone all the time at Move Christian Church. Shout out to that. Shout out to pickleball. All right, listen, y'all. I'm not gonna be here long, but I made this post about Phoebe, and people have been posting all about it. So I said, you know what? Let me just talk about it. Let me share my thoughts and ideas right here because I haven't really shared my thoughts and ideas on the post. I asked an open-ended, non-leading question on purpose. In fact, I'm gonna share the screen so y'all can see the hoopla and the hubbub. Let's share this screen over here. Boom, boom. So this is my question. This is an open poll. Has Phoebe had an overall positive or negative impact on the health of Albany, Georgia? And so we're going to talk about Albany's health for just a bit. And all of this, of course, came about because there was this event that went on with the who was this that held this thing? That was the Georgia Health Policy Institute from the Andrew Young College at Georgia State. Let me share this live. Also, too, make sure y'all share the live, y'all. Hold on, let me refresh so I can share this live. But they brought these people down from Atlanta and from wherever else in Georgia to come and study the ideas, figure out what the problems are, what the solutions are, and what we can do to fix the problems. So they did what everyone has always done. Hold on, what? Where's the live? Hold on. How come I can't share the live? Hold on. This is rude. But anyway, we went through the same exercises of let's break into groups and let's talk about this issue and this part of the issue and all that part of the issue. And fortunately, there was a white lady that spoke up right before me. And she said what I was feeling, what I'm always feeling is, what are we doing after this? What are the results? What are the goals? Are there going to be action steps? Are we actually going to move the needle? And the man that was hosting, moderating the whole thing, he flat out said, we're not here to develop a plan. He said, we're here to talk about the interest and the ability to, I guess, do whatever the process was that we come up with. So we had this whole discussion, and I get up there and I talk, and I made the point that Phoebe is not here for our health. They're not here to actually have a positive impact on the community health of Albany, Georgia. They're here for profit. And some Phoebe people, interrupted me and was like, no, you can't say that, and blah, 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 blah. But before I get into these comments and we break down who's coming and who's saying what in here, I want to talk about reality real quick. And I want to, because we got to be real. In fact, with the healthcare, if a doctor misdiagnoses a patient because they weren't honest, it's not the doctor's fault. It's the patient's fault. That you need to be honest about what the ailment is so that you can properly diagnose the solution or diagnose the problem, whatever, so you can apply the correct solution. So if we're not being honest about the fact that there are thousands of people that have horrible horror stories when it comes to dealing with Phoebe health systems. I personally have not really had that many experiences with Phoebe after I was born. So I honestly, me personally, don't have any bad experience that I can point to and say, oh yeah, this happened. But I have loved ones who have, several loved ones who have had horrible experiences. And so if we're being honest about actually doing something to affect positive change for our health and as a community and as a city, we have to be honest about what the problems are. And if one of the problems is our monopolistic healthcare system does a subpar job of meeting the needs, we need to address that, and we need to be honest about it. They spent billions on this building. In fact, and I just shared it in the Albany Forward group. Shout out, go follow the Albany Forward group. But Commissioner Young went live in there, showing all the new renovations and all this stuff. And so they're going to be training new nurses and all this, what. But if the culture in the hospital doesn't change to where people are coming home with these horror stories, coming home with more diseases, losing their lives, all kind of crap, then it is where's that money really going? And where's the positive impact? And so let's jump into these comments. And another thing also too, well, we can get in the comments because I made the comment in here. So Freddie Powell Sims, our wonderful senator, jumped in and said, let me make this bigger. Freddie Powell Sims say, just imagine serving the area, roughly 25 to 30 rural and poor counties without a hospital. Does that answer your question? I said, no, it doesn't answer my question. Because one, I asked, have they had an overall positive or negative impact? Just because they serve in the area doesn't mean that they're having a positive impact. They're serving the area, but if, again, people are still suffering in many ways, then where's the success? And so, in fact, let me scroll down to a point that I made in here, which was someone wise said to me earlier today that a good way to gauge the impact of a healthcare system on a community is to see the overall health of that community. And using that metric, can we say that Phoebe has had an overall positive or negative impact on I can't even find my comments. It's okay. It's over 50 comments on this thing now. I can't even do it, y'all. I'm not going to do it. But anyway, y'all go leave y'all comments and y'all's thoughts on the post as well. Engage in the conversation. And again, I'm not bashing Phoebe in this post. I asked an open-ended question, and the people are just sharing their experiences. There are already some bad stories in the comments of people. Somebody said they lost their wife. Shout out to Marcus Lamb. Shout out to he's a beautiful artist, makes movies and whatnot. His wife Kelsey, wonderful graphic artist, wonderful creator herself. I know them. What's up? What's it? Oh, well, shoot. They right here, but I ain't finna scroll through these comments. It's just too many. I'm encouraging people to engage in these comments. But it's a lot. And one thing I can say too, another point that I made in the comments is we know for a fact that these doctors and these medical professionals are all aware that you can eat yourself to health, but they're not prescribing food to help prevent these and fix these diseases. They're prescribing these pharmaceuticals. And so what do we suffer from here in Albany? We suffer from preventable diseases like heart disease, diabetes, high blood pressure, kidney disease. These things that are very preventable if you switch your diet, if you remove the processed foods, get rid of the sugars, add vegetables, add water, get sunlight, exercise. You actually change your habits. You can reverse those and prevent those diseases. They know this. These medical professionals know this more than the average person. But they still tell you, oh no, take this pill. Here, have this medication here that's going to give you other side effects and other diseases and other things that are going wrong, arthritis and all this stuff, inflammation in the knees and whatnot, because you're taking this stuff that's ruining your body. They know this, and they're getting kickbacks from these prescriptions that they give to you. When they prescribe the newest medicine that they release, these doctors get money back for that. And so if we're aware of that fact, we have to be honest about it and make better decisions accordingly. So we've got medical professionals that we know are working for profit. Hey, I'm working for profit. No harm, no foul, right? But we have to be honest about that. And so when you have a healthcare system that is working for profit, they're prescribing these pharmaceuticals, they're giving subpar customer service. Shout out to Marion Frost, who said she actually had excellent customer service when she went. And of course, there are always going to be some good stories. Not everybody dies when they go to Phoebe, but sadly, I would love to see those numbers, the ratio numbers of the deaths of the people that go in there, because it just seems scary. I don't know everybody in Albany by no means, but I don't know every human being in this city. But boy, I know a lot of people that have had loved ones die in Phoebe's care. And that's not okay. So, without bashing anybody, because I think just being honest is just being honest, and people feel bashed and they feel accosted when the truth is spoken. But unfortunately, that's just what the truth does. That is how the truth works. It hurts sometimes, but that is where we have to start if we're going to be serious about actually impacting change and impacting health in this city in a positive way. So shout out to the work that Phoebe has done, the good work that has happened there. Because they got that little garden, that little plot of land over there on the side. Shout out to that. And I'm not sure whatever else they do, but I'm sure that there's some positive things that happen there. And to those women that spoke up in that meeting and defended Phoebe, Nia and I had a very good discussion about the psychology of all of that. And so I understand that y'all felt triggered and hit and targeted when I said Phoebe is, just here for profit, and y'all felt that y'all needed to defend it because y'all are part of that system and y'all get paid from that system, and y'all are seeing this from y'all's view that y'all have individually the best interest of the people at heart. But I'm speaking about the system at large, and I hope that y'all aren't the system, and the system ain't y'all. And I'm very aware that there are individual people that are in the Phoebe healthcare system that are working for the best of the people. I got family that work for Phoebe. And so, and I know my family care for people. So we good people. Unfortunately, those people work for a system that has to make profit. And so you're limited in the positive impact that you can have, you positive, wonderful people that I was not disparaging personally in that meeting. I was definitely speaking about healthcare systems and how they're run. And even the lady, I think her name was Miss Robin, who spoke about she worked with a hospital to give them, some money. They did some money, whatever, to keep the hospital open. And it was just that, just to keep the hospital open. Shout out to that. But I'm sure it benefits you somehow. And even if it don't, like, y'all, the healthcare system, again, let's just go back to the point that was made. If y'all know that you can eat your way to health, but you're still prescribing pharmaceuticals that will give you harmful side effects, you're not working for the health, for the best interests of the people. You're working for your profit. And again, I'm not disparaging anybody by speaking that fact, but that's a fact. And it may hurt. It may make you uncomfortable. It may, all this other stuff, but it's a fact. And so, yeah, I hope you all do your due diligence and learn and read and figure out what you can do besides just going to a Phoebe or even Archbold or wherever else that you want to travel to. People travel to Tifton, Columbus, wherever you want to go to get your health care. You don't need the modern healthcare system unless you need some surgery to cut off a limb or dissect something. You really don't need the hospital. You can prevent diseases by changing your diet. This isn't, whatever's this fantasy that I'm talking. This is science that these doctors that work in Phoebe healthcare systems and all these other healthcare systems know. They know it very well. And so some time ago, you would get in trouble online on Facebook specifically for speaking that fact about COVID. When I would make posts about how to prevent COVID, how to actually fix your immune system by changing your diet, posts were flagged and things like that. So we can talk about censorship on a whole nother post. We're gonna talk about all that fun stuff later. But man, listen, I encourage y'all to work on your health. Make sure your health is top tier so that you ain't got to go to a Phoebe. I ain't had to go to a hospital. I can't remember when, thank God, because I take my own advice. I eat vegetables, I drink water. As much as I can, I try to cut down the processed foods and the cheese and the milk and dairy, and I get sunlight. And I don't take vitamins. I don't do all this other stuff. I don't have a primary care physician. And shoot, I haven't gotten sick. When COVID came, you know what? I got sick at the end of 2021, but I think that was just depression that hit me. So, but anyway, I love y'all. I'm finna get out of here. I encourage y'all to jump on that post. If y'all have had a positive or negative experience with Phoebe, please share it on this post, because what I would like to see is actually Phoebe host a town hall where they actually hear the community members and hear what the people have to say about their experiences and about things that they could be doing better. So, but that somebody said, who's that said that sounded like right? That sounded like too much like right. But I hope that we can do that. Phoebe execs, Phoebe leaders, make that happen. If y'all are leaders, make it happen, because that's the leadership we need. Anyway, I love y'all. I'm finna go because I didn't do a Wednesday Albany forward live this morning, so I apologize for that. So this is kind of the makeup for that too. I think no, wait, hold on. There's more comments on the post. Hold on before I go. Al win and commented. Gio and Cote. Look, people I ain't spoke to in a minute. Omar Salam is liking stuff in there. All right. Yeah, the comments are good. People are leaving some good, thoughtful, long stuff on here. So anyway, I'm finna go. I love y'all. 2 fingers, east side.